Welcome to The Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter @FoleyTom, and the hashtag The Virtual Shift. Today we have a special guest I'm very excited to talk with, Jerry Gross. He is the Chief Executive Officer and founder of Vytal and Chief Executive Officer of Medvantx. Jerry, welcome to the program.
Hi, Tom, and thanks for inviting me on the program to talk to you today.
Awesome. I appreciate you being here. So, Jerry, tell me a little bit about yourself and tell us a little bit about Vytal and Medvantx and how they are creating shifts in the market.
Yeah, so my name is Jeremy Gross, and go by Jerry, CEO of Medvantx, which is one of the largest independent mail order pharmacies in the country today, as well as its e-commerce unit. Direct-to-patient e-commerce business known as Vytal. I have a deep background in technology. Started off in financial services and then transferred into healthcare a number of years ago. C-level and leadership roles in McKesson, Amgen, and a variety of startups, healthcare startups as well. Before taking on both the Chief Technology Officer role at Medvantx and then ultimately the CEO role at Medvantx.
Awesome. Very good. So some interesting statistics here. Let's see here. By 2040, an estimated 95% of all purchases will be through e-commerce. It's an interesting stat, and I immediately thought, geez, my grandparents went from the horse to the car, and we're going to experience the total transformation of healthcare in our lifetime. Not necessarily an equal equivalence, but two dramatic shifts. Obviously, going from the horse to the car and all of what the car did for us, and then but the healthcare market in and of itself. That coupled with the idea, the other stat here, telehealth claim lines increased 3,550% from 2019 to 2020, went from 0.2% of all medical claims to over 6%. So it tells me that the shift is moving towards the home. So instead of the hospital being the center of care, or the brick and mortar being the center of care, and nonetheless the hospital, the home becomes the center of care. And that's really the big shift. We go from, in 100 years, 100 and some years, we're going from the horse to the car, and from the brick and mortar of the clinics that everybody traveled to the home being that setting of care. Talk to me a little bit about that.
So any metric or statistic that's out there today, 24 hours later, it's out of date. The rate of change. The rate of change is increasing, not just change, but the multiplier effect, and that's due to a couple of factors. One is we're going through, and we've gone through the ultimate trigger for digital transformation, which is the pandemic. And why I call it the ultimate trigger is none of us had any option but to change with digital transformation. And so everyone was forced to change how we shop, how we socialize. We all had to come up with our own version of what I call curbside service. Okay. Mm-hmm. Everyone's had to, and we were forced to do it. There was overnight, we were forced to do it. We were forced to do it inside companies, and as patients, in getting access to care, we were forced to do it. The great news about it is that the technologies that enable that to happen, such as GenieMD and telehealth, are there. So whereas, if this had happened, say, a decade ago, the ubiquitous nature of high bandwidth networks and Wi-Fi and all of the enabling infrastructure and technology was still evolving, but it's all there today. We're 5G. Everyone's got, my grandmother is worried about her Wi-Fi bandwidth at home. Okay, so it's all the enabling technologies are there to make that shift happen. But we had no choice. So I look at it as digital transformation is not just the technology, but also the culture and the fact that we are now accepting our own curbside service, whether it's patient access to patients. Patients are now expecting this type of access and this type of engagement. Now, as it relates to a couple of decades ago, or even shorter than that, our view of healthcare was an annual physical. Right, you'd go in for your annual physical, you'd get your one blood test, a full panel blood test, and it would be a point in time in terms of what your health is. That is suboptimum. Now it's clearly understood that it needs to be a continuum of monitoring of your health, and it's in the trends. Whether those are bad trends in terms of blood sugar or A1C or whatever it is, or in the trends in terms of the right behaviors, and that's all possible now with digital health. So Apple Watches, and everyone's expecting that now to be able to have that kind of care and that kind of monitoring, not by going into the office, not by going into some retail pharmacy. But by doing it in real time at home, and now that's a minimum ticket to the game. And you can blame Amazon for this. Amazon has made us all, expect that everything is going to be delivered to the doorstep at home when and where and when we need it at any time. And so there's a combination of things going on here, but the fact of the matter is it's a perfect storm, for want of a better description, in terms of the pandemic.
Yeah, you nailed it, and then my audience is going to say, "Oh, I know what Tom's going to say next to that." And the issue, the stat that I always repeat is the average Medicare patient has 5 chronic conditions. They see 9 different doctors. They spend 15 hours in front of their doctor in a given year. The audience is going to say it with me, audience. What happens the other 8,745 hours? That's when you're talking about the instance in time, that happens within 15 minutes, 15 hours in a given year for those multiple chronic conditions with a patient. So now we are moving towards virtual care. And my definition of virtual care isn't a video visit, right? We might be in a video visit right now, but that's not telehealth. That's part of telehealth. When I talk about virtual care, I'm talking about the idea of engaging in multiple modalities virtually, and when you say continue, and it's almost providing that continuous care, because you add on remote patient monitoring, you add on chronic care management, you add on part of the 2022 new criteria for remote therapeutic monitoring, right? It's that whole continuum. That's virtual care, right? And the platforms that support that are not only the technology platform that allows that engagement and the monitoring, it's platforms like yours that ultimately allow that patient to stay in the home, if you will, if their mobility is challenged, and they bring the pharmaceuticals to them, right? So maybe the audience might not have been aware of that direct to pharmacy tagline. Can you explain a little bit about that, direct to pharmacy or direct to patient? I'm sorry, in your world, and how that impacts the market?
Yeah, sure. So, well, first of all, direct to patient is really, in our view, digital transformation. Okay, it's digital transformation of the patient experience, and the stakeholders that surround the patient. And the stakeholders can be the provider, they can be the payer, they can be a caregiver, and so forth. And it's this digital transformation is around about creating new or modifying existing processes and culture and so forth. And it all starts. How you think about it is that it all begins and ends with the engagement with the patient and the experience the patient is going through. And there are a number of different distinct ways this patient experience is going to change. First and foremost, it's all about the data, the analytics, the IoT or Internet of Things, machine learning. But this virtual care is 7/24 monitoring and outreach on an exception basis. So I won't mention the name, but there are a number of concierge, healthcare concierge services these days that they're monitoring me 7/24. And then every so often, the provider will reach out and say, Jerry, I was looking at your exercise regimen this week, and you didn't get your steps in, or Jerry, you haven't taken up a refill on a medication. Okay, so what is that driving to? That's driving to the holy grail of big pharma or life sciences, which is adherence. That patients are, once they're prescribed, they're adherent to the regimen of that medication. So for us, I think that it's all about solving problems along the patient journey that we all go through. And from a pharmacy standpoint, there's essentially the front end of this experience, which is could be the traditional doctor visit. Then again, in this new virtual care world, it could be a telehealth experience where someone has either identified symptoms themselves or through monitoring, symptoms have been identified. And from there, what Vytal does is that we have a very powerful, bespoke, branded website builder that not within months or weeks or days, but within hours, a manufacturer can spin up a branded online patient experience to directly connect with that patient with all of the e-commerce capability, all of the insights around that to inform both the patient and then ultimately, if the patient opts in, to inform their provider as well as to what's going on. And then from there, the experience will go through everything from the ultimate diagnosis, treatment selection, and then, as I mentioned earlier, monitoring and adherence. But at the end of the day, our mission, Medvantx's mission and our e-commerce unit, which is Vytal, is all about directly increasing the access to affordable medications and healthcare. And to that end, we have on our platform a variety of services that a manufacturer can cherry pick. They can, in essence, a manufacturer can set up their own pharmacy, a pharmacy that is regulatory compliant, highly secure, and essentially maintains the strictest privacy and guarantees both the quality and safety of the medications that are being prescribed, as well as then the adherence and monitoring and the follow-up. And then with the insights around that, bundling potentially other medications or services that increase the efficacy and the health outcomes of that particular disease state that patient has. One of the 3 to 5 common disease states we'll all be managing when we're over the age of 50.
Yeah, exactly. If you're just tuning in, you're listening to The Virtual Shift. I'm your host, Tom Foley. We're talking with Jerry Gross. He is the Chief Executive Officer and founder of Vytal and Chief Executive Officer of Medvantx. Great insights, Jerry. So, so ultimately what you're, in some context, you're streamlining the supply chain, if you will, of getting pharmaceuticals or drug therapies from the manufacturer directly to the patient. Is that a fair statement?
Yeah, I mean, there's a couple of common problems we're solving for manufacturers. Our platform solves. One is it enables manufacturers to bypass the formulary and connect with brand loyal patients, directly giving them a reliable alternative to what is typically an unreliable or untraditional supply chain. What we're also doing is we're giving manufacturers the power to support brand loyal patients when they've lost or they're facing loss of exclusivity around a medication. And then, and in some cases, that's bypassing PBMs, ultimately addressing formulary exclusion and taking back control, frankly, with the loss of exclusivity. So those are the common problems so our customer, being the manufacturer, whether it's biopharma, life sciences, these are the common problems that the Vytal platform is solving for. At the same time, we're streamlining the experience with the patient. And this direct to patient is also with a lot of our customers, they are not struggling, but they need help in entering this new digital marketing world and getting their brand exposed from a digital standpoint. And so our platform has deep capabilities into digital marketing and outreach with all of the diagnostics and metrics associated with that.
Interesting. I would have to think that the streamlining of the supply chain and the ability to reduce costs increases access, to some degree, of a patient, because a lot of patients, and you probably know these stats working in the industry, scripts are written all the time, right? I'm a patient. I've gone to the trouble of scheduling an appointment, waiting my 3 weeks, getting the appointment, having the exams, and getting having the tests, getting the results, right? All that stuff. And I get a script. 50% of them never go to the pharmacy to fill it. That's one aspect of it. And then even if I filled it, if the fill is only for 30 days and you have a chronic condition, getting the refill is a challenge, right? So, and sometimes it comes down to, can I afford it? Right. And the fact that you're taking, you're putting dollars back into the consumer's pocket, if you will, because you're streamlining the supply chain and you're going direct to patient. I would have to think that creates a domino in that patients have have a better opportunity to engage in the therapy in which their provider prescribed. Right? Would you agree, disagree with thoughts on that?
Yeah, and I think that and the point you're raising, which is half the prescriptions are never filled, which then leads you down the road that death caused by not taking prescriptions on the regimen or the protocols appropriately is a serious problem to overcome. But here's the thing of it: with the Vytal platform, we automate, and in some respects, say like on a refill, for example, if the patient opts in, and we make it compelling for them to opt in through things like a loyalty program. So, which is, we've taken aspects from the retail consumer e-commerce experience and put it into the healthcare, which, is somewhat of, some might think it's controversial, but it's actually what actually increases conversion rates and increases adherence. And it's a better outcome from an efficacy standpoint. So we're automating refill, so people don't have to worry. We don't have to pester the patient. And in fact, we would tee up if they've run out of refills and they need another prescription. That's all handled behind the scenes, and we tee that all up, and we just say, hey, here's availability to through telehealth. Talk to your provider and get a new prescription if necessary. So we try to take all of that and automate it either through data or just through the knowledge of the medication and the current and the prescription management, and we take all that on, and then and as a result, we're seeing prescriptions pretty much 100% efficacy in terms of the or rather compliance. When someone goes through that part of the workflow, they once that prescription is created and processed, they get their medication, and then our refill rate is actually astonishing in terms of the fact that because it's all automated.
Yeah. So this all of what we do is the entire healthcare system, that is to help a patient move along this awareness to wellness continuum, right? It's all about getting well, and the more that they remain on therapy, the more that they can either maintain or progress their state of wellness and live a happier life. So with that, we only have a minute or two left here. Jerry, tell us a little bit about where the industry is heading. What do you see? Put the crystal ball on out and take it out and tell us where we're going to be in a couple of years.
Well, I think that more rate of so increasing rate of change, especially around digital transformation in healthcare. I think that there is going to be more consolidation around technology platforms, which is all good, because there'll be cross connection of both technology and data. But I see that the access to in real time healthcare at home, the adoption is going to be it's going to be 100% within 3 years. So and I'm going to age myself here, but I harken back to online banking. I remember a time when people said, online banking, no one's ever going to do that, right? And then there was all the the confusion around the cloud. People saying on the cloud, it's unsafe. Well, where the heck do you think online banking is conducted? It's conducted in the cloud. Right.
I remember saying to my wife when we were moving out of our first townhouse, we can go any place as long as there's a Mac machine in the neighborhood, right?
So
we're long past that idea.
Yeah. So my view is there will be, so there's this emerging environment called the metaverse, and the metaverse is emerging of all of the digital technologies today, plus augmented reality and virtual reality, and the cross-connecting of AR and VR with digital health, so that and ultimately with the development of sensors and so forth. I mean, there's no substitute for a blood test. I get it, but the innovation that's happening in that space, it'll be pretty close to being able to diagnose remotely. I see more of that in the future.
Awesome. Jerry Gross, Chief Executive Officer and founder of Vytal and Chief Executive Officer of Medvantx. Thank you very much. It was a very compelling conversation. Appreciate you joining the show.
All right, Tom, thanks for having me. And anytime, I'd love to come back and chat again.
I'm going to take you up on that offer. Thank
All
you.
right.
I would like to thank the show sponsors, both HP and Intel. HP Engage long lifecycle products provide the stability, safety, and security you need, plus flexibility and performance designed for today and tomorrow. As well, Intel would like you to know we're going above and beyond together with new standards for business with the latest Intel vPro processors, delivering what IT needs for performance, security, remote manageability, and stability. And be sure to check out the program page on healthcarenowradio.com. And remember, connect or follow me on LinkedIn, Twitter @FoleyTom, and follow the show's hashtag, The Virtual Shift. I'm Tom Foley. Until the next shift.